Hello, how are you? Welcome to Health Dubo. Good to have you here today. My name is Leah. I'm a medical biochemist and a weight management coach. Today, we are going to look at how to reverse the symptoms of type 2 diabetes. How do we reverse the symptoms of type 2 diabetes? There are two types of diabetes. There is type 1 diabetes and there is type 2 diabetes. This video is specifically addressing the reversal of type 2 diabetes. As of now, I'm not aware of any clinical study that has been done to show how one can reverse the symptoms of type 1 diabetes. Type 2 diabetes is a hormonal problem. It is caused when the body cannot produce enough insulin to regulate the blood glucose in the body, or when one has got insulin resistance and therefore they need to depend on an insulin jab, or they need to depend on some medication to balance the levels of glucose in the body. It is possible to reverse type 2 diabetes. And what do we mean by reversing the symptoms? It is possible for you to stay without it's possible for your body to regulate the blood glucose levels without depending on drugs and without depending on insulin jabs. So what do you do, or what do you need to do to reverse the symptoms of type 2 diabetes? One is to lose weight. Yes. That is where you begin. That is where you start. You need to lose weight in order to reverse the symptoms of type 2 diabetes. Studies have been done, and the most recent study is what was done in Canada in 2018, and it was shown that people who were able to lose 15 to 40 kilograms of fat, that is of weight, based on their initial starting weight, were able to reverse the symptoms of type 2 diabetes within 1 year. If you've gone to the doctor and the doctor have diagnosed you with type 2 diabetes, if your endocrinologist or your diabetologist is managing your condition, do not even ask any other question. The first thing that you should do is to put yourself on a weight management program and see how your weight can be within the safety zone. See how your BMI can be less than 30. See how your midweight circumference can be less than half of your weight, okay? And that will be the key step to reversing the symptoms of type 2 diabetes. It is possible to stay without drugs when you are diagnosed with type 2 diabetes. The second thing that you need to do when you are diagnosed with type 2 diabetes is to fast. Going without food for 72 hours have been shown to have clinical results in managing and reversing the symptoms of type 2 diabetes. Because you remember, we say type 2 diabetes is a hormonal issue. When you fast for at least 72 hours, your body is able to regulate itself and is able to go about the hormonal imbalances in your body to a point where your own pancreas is able to produce enough insulin to regulate your blood glucose. And when I say for you to fast for 72 hours, I know how important it is, especially for a diabetic patient, because your body is not able to balance its own sugar levels. You need to do this kind of a fast when you're supervised. You need to do this under clinical observation. You should not just be alone. Because again, if your glucose levels go below a certain level, you're likely to pass out. You're likely to have a negative outcome, okay? However, it is being shown that anytime your body is on ketones, when you fast and you go without food, your body does not depend on glucose because you're not taking food. Your body burns fat. The fat that is stored in your body is what is used to fuel your body. And it has been shown, studies have been done, and it is being shown that anytime your body is on ketones, it's able to regulate and to repair so many of the internal systems that are not functioning, including the insulin production system in your body. So fasting for at least 72 hours, those are 3 days, periodically, maybe after 10 days or maybe after 2 weeks or whatever will work for you, has been shown to have positive outcomes in reversing the symptoms of type 2 diabetes. And the other key thing that you need to do is to exercise. Exercise reverses the symptoms of type 2 diabetes. Why? Because exercise have been shown by research, number one, to contribute positively in weight loss, and then number two, to help in balancing the hormones in the body. And you remember we said with diabetes, the main issue is insulin, which is a hormone. So mine is to wish you well. Mine is to sincerely hope that you will be able to lose weight, that you will be able to fast, and that you will be able to reverse the symptoms of type 2 diabetes with exercise. And as I told you, I'm a medical biochemist. I am not your doctor, but I know it is possible to reverse type 2 diabetes. I wish you well. Bye.